They packed a hospital full of union reps, doctors and Democrats, all crying on cue about so-called Medicare cuts. But let me tell you something. If Medicare is so sacred, why are illegal immigrants getting free care while American vets are put on a waiting list? The people behind this, the politicians, the union bosses, the donors, aren't fighting for your health. They're fighting for control, and they're using your tax dollars to do it. Let's dive into this and see what they're not telling us about it. Let's jump right into it.
Well, good afternoon, everyone. It is my honor to join together with this team of phenomenal health workers and our leader to deliver a message or two or three or four or five about why these Medicaid cuts can be damaging to our country and to our healthcare facilities. So it is my honor to kick us off with our leader, Congressman Jeffries.
Thank you. Well, thank you, Dr. Scott, for your leadership, and it's an honor and a privilege to be here at the Brookdale Medical Center, One Brooklyn Health System, to be back home in Brooklyn, and to join together with stakeholders and leaders all across the healthcare ecosystem to speak in one voice and to oppose the GOP tax scam and the devastating cuts to Medicaid that are being proposed. Medicaid is a lifeline to so many people in this community, in this city, and all across the country. And the proposed cuts to Medicaid, the largest cuts being proposed to Medicaid in American history, are unacceptable, unconscionable, and un-American, and together we're going to do everything we can to stop them. Now, in the United States of America, it's got to be the case that healthcare is not simply a privilege available to the privileged few. Healthcare is a right. But for healthcare to be a right that is accessible to everyone, regardless of the type of community that you reside in, then the programs that exist, like Medicaid, the Affordable Care Act, the Children's Health Insurance Program, and of course, Medicare as well, must be sustained. In fact, what we know is that instead of trying to cut Medicaid and end this program as we know it, we need to enhance the Medicaid reimbursement rates for hospitals like Brookdale. I'm so thankful for the service that all of you provide, for the work that you do in this community. We know that this is a community, and the neighborhoods of Central Brooklyn have people that suffer disproportionately high rates of high blood pressure or diabetes or heart disease, and don't always have the access to the primary care that is necessary. And if you were to cut Medicaid, things aren't going to get better, they're going to get worse. Children will be hurt, everyday Americans will be hurt, people who rely on Medicaid with disabilities will be hurt, many older Americans will be hurt. So throughout the country, we are having Save Our Hospitals days of action during this entire week. And I have several wonderful hospitals all across the district that I represent, but I wanted to make sure that on this day I was here at Brookdale.
Next, we will have one of our registered nurses, Ms. Sibylla Douglas, who is also an 1199 delegate, who will give us a perspective from nursing.
Good afternoon, everyone. I'm Sibylla Daniel Douglas. I'm a registered nurse here at Brookdale, and I've been an employee at Brookdale for 35 years. And as Dr. Scott said, I'm also an RN delegate. The fight to save Medicaid is crucial because we provide care to an underserved and at-risk community. Our patients are already at a disadvantage, and Medicaid cuts will be extremely detrimental. These huge Medicaid cuts will impact our healthcare system and
Thank you very much. And now we will hear from Ms. Elaine Raffington, representing the Guild of 1199.
Good afternoon, everyone. Thanks for having me. Thanks for coming, Hakeem Jeffries. I am a proud employee of One Brooklyn Health System, Brookdale campus. Let me tell you about the Medicaid cut. I listen to the cries of the community. I'm a MOA, I'm also a health coach. We need Medicaid funding for this community. Mental health issue is a vast population of this neighborhood. Diabetes, hypertension. I often listen to the members, listen to the community. Anyway, moving forward, I'm asking Hakeem Jeffries to be the voice of reason for our community, not for our 1199 members alone, for our friends and family of this community, for management, for everyone.
All right, folks. So what do you think so far? Here's what they left out during their speech. The 1199 SEIU healthcare unit is one of the largest political donors to the Democrat Party. In fact, they have poured over $20 million into a left-wing campaign, and now they're staging these Medicare protests, not to help patients, but to protect their political funding pipeline. And I ask you this. If you're in a medical system, why does politics matter in there? Think about that. And let's say if you're a Republican or a conservative and you go there, they're mostly Democratic, would they not give you the proper care you're supposed to do? Food for thought. You think this is about saving lives? It's about saving votes. That's the game. Medicare is bloated with fraud used by millions who shouldn't qualify, and now being weaponized to keep blue cities afloat while middle America pays the price. So when you hear the emotional stories and watch the stage outrage, just remember who's really benefiting. The unions get power, the politician gets reelected, and the average American like yourself and I, we're left holding the bill. Please remember, if you like this segment, like, share, subscribe, stay informed and engaged. Until we meet in the next time, please be safe. Have a good one.